All right, welcome to my teaching presentation. Today it will be dealing with advocacy in a medical setting, and my name is Brandon Laurent. So, before we begin, I just want to paint a scenario. Imagine waking up with crippling pain or feeling sick, but the thing that you are most stressed about or anxious about is how that patient provider interaction will go. With that being said, my focus today is on help giving a few tips that can help alleviate a lot of that stress and pressure. And to begin with, I want to talk a bit about the communication theory known as ACT. ACT is the advocacy communication theory, which is all about buy in. It heavily is revolved around persuasion with a purpose. And in this case, we are trying to make sure that medical staff are persuaded to have further buy in into the mental, physical, and emotional well being of a patient. In essence, advocacy communication is all about motivating people to think, feel, or act differently in support of a cause by making thoughtful, targeted, and persuasive appeals. So, our first tip is centered around coming in with a good idea of what your chief complaint is. A chief complaint is essentially what is the biggest thing that is bothering you? What is the thing that brought us in today? So, tip one, chief complaint. Come in with a good understanding of your chief complaint. By chief complaint, once again, I mean what is bothering you. How long have you had these symptoms? Does anything make it worse or better? Has anything like this happened to you in the past? Diagnosis is like putting together a puzzle. The more information you can offer, the better doctors can make sense of everything and know what tests to order. Next, I want to talk about the importance of a medical record. Medical records are something that is very worthwhile for you to keep on your person because unfortunately, not all doctors are receptive to hearing from patients. This is when having your medical records and documentation can be extremely helpful. Do not shrink yourself and let anyone else have control in your care. By giving them a copy of your medical record, they are able to piece together what kind of diagnostic work you would require, and that will make the experience that much more helpful. Next, I want to talk about the importance of keeping a log of your vitals. So, the example that I'm going to give is if you've been running a temperature, keep a temperature log with you at all times. This will help them know when it has spiked, what other symptoms have come along with your fevers and your vital signs, so that they can thoughtfully piece together a means of helping you in this moment. My last tip for you is the fact that no one will care about your well being more than you or a loved one. So, if doctor visits can feel overwhelming, don't hesitate to bring a loved one to back you up or give secondary opinions on what they've seen or think is going on. Sometimes there can be strength in numbers, even for someone well versed in medical jargon and procedures. Lastly, I just want to say that when it comes to your health care and your well being, we understand how much of a barrier being able to communicate with your providers can be. Which is why, lastly, different providers require different styles of communication. This is why advocacy communication theory came into play. When building rapport with your provider, be mindful of whether a provider is receptive. This could help you determine what concise communication practices and persuasions are necessary for advocating for your needs or the needs of a loved one's. Lastly, I want to say thank you so much for paying attention to my presentation, and I hope that you find some of these tips helpful.